Those pediatric lung sounds can be tricky, especially with conditions like cystic fibrosis. Speaking of tricky, let's quickly talk about CF, a genetic condition. Think thick, sticky mucus, making it hard to breathe and digest food properly. Diagnosing CF often involves a sweat chloride test. Key signs include a persistent cough and unusually salty skin, with wheezing or crackles upon auscultation. Treatment focuses on managing mucus with therapies like chest physiotherapy and supporting digestion with pancreatic enzymes. Medications like mucolytics, antibiotics, and CFTR modulators are also crucial. And don't forget the basics of exercise and water therapy. Master pediatric nursing and understand conditions like CF with ease. Find nursing gems in the bio.